Good evening. My name's Jodie Sargent. Welcome to the webinar tonight. I'm Education Coordinator here at PHN Central Queensland Wide Bay Sunshine Coast. I'm really excited to introduce tonight Victoria Mount, who is the Immunisation Lead and Nurse Unit Manager of Sunshine Coast Public Health Unit. She'll be outlining the changes to the National Immunisation Program from the 1st of July 2020. And we're really looking forward, Victoria, to you speaking. Victoria's unfortunately just had to turn off her webcam because she had a bit of a dodgy connection. So we might leave that off tonight because we've got a super amount of attendees, which is great. Mine will go off shortly too when we get started. So before we commence tonight, I'd just like to pause for a moment and acknowledge the traditional custodians on the lands on which we meet tonight and pay my respects to elders past, present and emerging. And I'd also like to just indicate to you that there's an opportunity for you to ask questions during Victoria's presentation. You'll see on the right-hand side of your screen there's a questions bar, and you can chat in there and send us questions through. Perhaps hold off until you've heard what Victoria is going to present, because she might answer some of those questions during her presentation. And if you have got some questions, burning questions that haven't been answered, please make sure that you send those through to us, and we'll have an opportunity at the end of the webinar to pop those through. So without further ado, I'd like to hand over to Victoria.
Thanks very much, Jodie, and thanks everyone for joining tonight. So just to give an overview of what I'll be covering initially is I'll go through each of the vaccines that have changes as of the 1st of July. So the meningococcal vaccines, Men-B and Men-ACWY, the Hepatitis A vaccine, the pneumococcal vaccines, Pneumovax 23 and Prevnar 13, and also the Hib vaccine. And then I'll look at the groups that are affected by these changes: the Aboriginal and Torres Strait Islander people, people with medical risk conditions, and older people. We'll then just consider or look at some of the important considerations that are relevant, particularly for general practitioners and practice nurses. And then we'll point out the resources that have been developed to assist you with these changes. So are we able to change on to the next slide? Yeah. And then just the next one as well, thank you. So just starting with the meningococcal vaccine. So important to note, there's no changes to the recommendations for the use of meningococcal vaccines. However, some of the recommended vaccines will now be funded under the NIP. So specifically, meningococcal B vaccine will now be routinely available for Aboriginal and Torres Strait Islander infants from 2 months of age, with catch-up available for them up until the age of 2 for the first 3 years of the program. So just important to note that once they turn 2, catch-up will no longer be funded. And then meningococcal B vaccine and Men-ACWY vaccines will be funded for anyone with specified medical conditions that increase their risk of meningococcal disease. So just to have a look at those specified medical conditions, they are listed in the meningococcal chapter of the Handbook, but they include defects in or deficiency of complement components, including factor H, factor D, or properdin deficiency. The current or future treatment with eculizumab, or functional or anatomical asplenia, including sickle cell disease or hemoglobinopathies and congenital or acquired asplenia. So that's great news. And also just important to note that for Aboriginal and Torres Strait Islander infants, HIV infection and hematopoietic stem cell transplant recipients will also be covered. So just note as well that for some people, there will still be the recommendation for the meningococcal vaccines, but they won't necessarily be funded. So just be sure to refer to the Meningococcal Handbook for more specific advice about recommendations and funding. So this table here is from the ATAGI clinical advice statement, looking specifically at the recommendations for Bexsero and Nimenrix for medically at-risk people. And the good news is that the dosing recommendations are the same for both these, depending on the age the person presents. So for medically at-risk infants presenting between 6 weeks and 5 months, they do require 4 doses of both Bexsero and Nimenrix. So those doses should be at least 8 weeks apart, ideally, and the 4th dose should be given at 12 months and at least 8 weeks after the 3rd dose. If they present between 6 months and 11 months, they only require 3 doses. Once again, these should be 8 weeks apart at least, with the 3rd dose being at least given at 12 months and 8 weeks after the 2nd dose. And for people presenting after 12 months, they only require 2 doses, and these should be given at least 8 weeks apart. So the little asterisk there on this table is just pointing out the medical conditions that we discussed on the previous page. This is a very handy resource, this table, to be aware of. I've just added in a note down the bottom there to point out that for men ACWY, there are booster doses recommended for people who have ongoing increased risk of invasive meningococcal disease. And the interval between these booster doses depends on the age that they complete the primary course. So just refer to the Immunisation Handbook for more details about the interval. And at this stage, booster doses for meningococcal B vaccine are not recommended. So just looking at this table now, just the routine schedule for Aboriginal and Torres Strait Islander children. For healthy Indigenous children, Bexsero will be given in the 2+1 schedule. So at the 2 and 4 month mark, followed by a booster dose at 12 months. Children who have medical risk conditions will be given it at the 3+1, so at the 2, 4, 6 and 12 month mark. Other points just to note with Bexsero, we already discussed that the catch-up will be available for children up until the age of 2 for the first 3 years of the program. Bexsero won't be assessed under no jab, no pay. And Bexsero is associated with a high incidence of fevers, 38.5 and above, so the prophylactic use of paracetamol for children under the age of 2 is strongly recommended, and we advise providers to actually phone in advance and advise parents to make sure that they're giving an age-appropriate dose of paracetamol to the child at least half an hour prior to presenting for the vaccination. If it's not given, it can be given immediately afterwards as well. And a further 2 doses given at least 6 hours apart are also recommended. And also just important to note that it is considered acceptable and actually encouraged to give Bexsero at the same time as other vaccines on the schedule. However, some parents may prefer that it's separated, and if this is the case, it should be separated by a minimum interval of at least 3 days. and there is a recommendation that Bexsero should be given in a separate limb to the other vaccines. So this may present a problem for medically at-risk children who are having to receive 4 vaccines in the one visit when they're less than 12 months of age, because obviously we don't have the deltoids muscles to use. So just note that there are some really clear recommendations and guidelines in the Immunisation Handbook about selecting the correct injection site. Obviously, for children under the age of 12 months, the ideal site is the anterior lateral thigh. The ventrogluteal site can also be used, but there's obviously risk involved in this if it isn't identified correctly. So our preference would be, if a child is having to receive 4 vaccines, that they can receive 3 on one visit, followed by the Bexsero at least 3 days later. If there is any concern, however, that there may be a lost opportunity if the parent may not return, or if it was going to be extremely inconvenient for them to return, there would be the option of giving the 4 vaccines in one visit. And as demonstrated here, you could, for example, give the Infanrix Hixa and the Prevnar 13 IM into the right thigh, making sure they were at least 2.5 centimetres apart. The Nimenrix could be given IM into the right ventrogluteal site, and then the Bexsero could be given into the left anterolateral thigh. So this picture is also straight from the handbook, just as demonstrating the clear guidelines for identifying the correct ventrogluteal injection site. So yeah, just wanting to point out the importance of making sure you refer to the handbook, and also note that the handbook's now also available as an app, which is really convenient and accessible. So now just moving on to Hepatitis A vaccine changes. So the change here is just that instead of being given at 12 months and 18 months, it will now be given at 18 months and 4 years. And this is essentially to accommodate the introduction of Bexsero onto the NIP, just to reduce the number of vaccines given to Indigenous children at 12 months. So the important thing is just to note that there is still a minimum interval of 6 months, and also that there will be a transition period, obviously, over the next 3 years as children are moving on to the routine new schedule. So it will just be really important for providers to be, we can move on to the next slide now, if that's all right. There will be very important for providers to be checking air records as Indigenous children present, just to check what their hepatitis A vaccination status is, amongst other things, and make sure that they're age appropriately vaccinated. So this is not expected to increase incidence of hepatitis A disease in Indigenous children, as the current epidemiology of disease is very low. Vaccine effectiveness is very high in young children, and antibody persistence after hepatitis A vaccination. So from January 2023, most 4-year-olds will be due for a second dose, and from July 2023, the second dose for all 4-year-olds will be routine. So this table here is just showing, taking us through the transition period. So as of the 1st of July, if you have a 12 to 18-month-old present and they've had 1 previous dose of hepatitis A vaccine, then they can get their second dose at either 18 months or 4 years. if they've already had 2 hepatitis A vaccines at least 6 months apart, they won't need to receive a second one. If they present between 12 and 18 months and they haven't had any hepatitis A vaccines, then you'll start them according to the new schedule and book them in to have their first one when they are 18 months and the second one when they're 4 years old. For 18 to 4-year-olds presenting, if they haven't had any, for 18-month-olds to 4-year-olds presenting, if they haven't had any hepatitis A vaccines, you should give one on presentation and then their second one when they're 4 years old. And if they've had the 1 dose, you'll just give the second one when they're 4 years old. And for 4 to 10-year-olds presenting, if they haven't had any previous doses, you'll give one on presentation and then the second one 6 months later. And if they've had 1 dose, you'll give the second dose on presentation, making sure it's at least 6 months after their previous dose. Yeah, so once again, just ensuring the minimum interval of the 6 months and of course, there's no need to have more than 2 doses of the hepatitis A vaccine. So now moving on to the changes associated with the pneumococcal vaccine. So the recommendations around the pneumococcal vaccine use and funding have changed. These changes mostly affect children and adults with conditions that increase their risk of pneumococcal disease. Aboriginal and Torres Strait Islander children, Aboriginal and Torres Strait Islander adults from 50 years of age, and non-Indigenous older adults from 70 years of age. So also a big change is that the list of conditions has been updated. I'm sure this will be a welcome change because we no longer have the Category A and Category B. It has been simplified into a simple list. And the handbook now does indicate which conditions are funded and which conditions are only recommended to receive pneumococcal vaccine. Be aware that there are remain minimum intervals associated with between different vaccines, so please refer to the handbook for these minimum intervals. And as I said previously, just note that not all conditions associated with an increased risk do attract funding. So just be sure to refer to the minimum intervals information in the handbook. This table here just provides a summary of the conditions that do have funding. So there are differences or slight difference between under 5s and those over 5s, specifically cardiac disease, as we can see, is funded for children under 5, but people over 5, it's obviously recommended, but it won't be funded. Just note for renal disease, it is dependent on their EGFR, so those under 15 mils will be funded, but anything over that won't be. And the others I can let you read through in your own time. So just to go through the actual changes, this is the schedule for children. So for non-Indigenous children, there won't be any changes. They will continue to receive vaccines at 2, 4 and 12 months of age, so the usual 3-dose schedule. For Aboriginal and Torres Strait Islander children, they'll continue to, and children with medical risk conditions, they will continue to receive the Prevnar 13 at 2, 4, 6 and 12 months of age. But there will now also be a recommendation for 2 lifetime doses of the Pneumovax 23. So they'll receive one at 4 years of age and a second dose 5 to 10 years after the first dose of Pneumovax 23. So just to note that the lifetime doses of Pneumovax 3 is now 2 doses. And just be sure to refer to the relevant catch-up table for children under 5 with medical risk conditions in the handbook for number of doses required and the intervals, because this will depend on the age that they present and the number of previous doses they've had. So now just looking at adults without medical conditions. So all non-Indigenous adults will now be recommended to receive a Prevnar 13 at 70 years of age. So there will no longer be the recommendation for adults to receive a Pneumovax 23 at 65 years of age. So they'll receive the Prevnar at 70 instead. And the time point for Indigenous adults will remain at 50 years. However, they will be recommended to receive a Prevnar 13 at age 50, followed by 2 doses of Pneumovax 23. The first dose should be given 2 to 12 months after receiving the Prevnar 13. And the second dose should be given 5 to 10 years after they received their first dose. So once again, only the 2 doses of Pneumovax 23 is recommended in a person's lifetime. So if they had received previous Pneumovax 23, they would obviously only need the number. If they've only received 1, they would receive a further 1 dose 2 to 12 months after the Prevnar 13. And if they had received 2 previous Pneumovax 23, they wouldn't require anything further. If somebody had previously received a Prevnar 13 according to the Category A, Category B schedule, there would not be any requirement for them to be given an additional dose of Prevnar 13. I think we might have just missed a slide there, did we? Or yeah. Just the individuals greater than 12 months. Yeah. Yeah, that's it. Yeah, so for individuals greater than 12 months with medical risk conditions, there's a recommendation for them to receive a Prevnar 13 at diagnosis, followed by 2 additional doses of the Pneumovax 23. Once again, the Pneumovax 23 being given 2 to 12 months after the Prevnar 13, and the second dose a minimum of 5 years, but 5 to 10 years after the previous dose of Pneumovax 23. It's important to note that if Pneumovax 23 had been given to someone previously, there needs to be at least a 12-month minimum interval between a Pneumovax 23 and a Prevnar 13 being given. And this schedule is recommended for everyone. So even anyone who's had existing medical conditions that do attract funding, it doesn't have to be newly diagnosed as such for them to be eligible for these vaccines. So anyone who hasn't received these vaccines in the past should be vaccinated accordingly. And then just the Hib vaccine from the 1st of July, it is recommended that any adult and children or child above 5 years of age with asplenia or hyposplenia, they will be funded for the Hib vaccine if they have not been vaccinated or had a full course in childhood. And at this stage, booster doses of Hib are not required. And just note, Hib vaccine is also recommended for adults and children over 5 years of age who've had a hematopoietic stem cell transplant, but this is unfortunately not funded under the NIP. So now just having a closer look at the groups that are affected by these changes that we've already mentioned, obviously, but Aboriginal and Torres Strait Islander people Just in summary, there's obviously the significant change bringing in MenB for under 2-year-olds. There's the timing of the hepatitis A to consider. And then there's now the 2 doses of Pneumovax 23. We've got children and adults with risk conditions are now eligible for additional meningococcal, pneumococcal, and Hib vaccines. So please refer to the Australian Immunisation Handbook and ATAGI statements for further information on these. And we've got all adults who are 50 years and older who are now recommended Prevnar 13 plus the additional 2 doses of Pneumovax 23. So looking at people with medical risk conditions, we've got additionally funded MenB and MenACWY vaccines, now funded for asplenia and hyposplenia, complement deficiency, and those receiving treatment with eculizumab. Aboriginal and Torres Strait Islander infants with HIV or hematopoietic stem cell transplant are also funded for additional doses of the MenB and MenACWY. And we've also got the booster doses of MenACWY funded for people with ongoing risk of invasive meningococcal disease due to these specified medical conditions. And then looking at pneumococcal vaccines, the list of conditions associated with an increased risk has been updated, and the number and timing of vaccines will depend on the age of presentation and the history of pneumococcal vaccination. So once again, refer to the handbook. And Hib vaccine is now funded for all people over 5 with asplenia or hyposplenia who haven't received an age-appropriate Hib vaccine course in the past. Yeah. And for older people, the Prevnar 13 is now recommended at 70 years of age. So if the individual has previously received a Pneumovax 23, the dose of Prevnar 13 should be given at least 12 months after the last dose of Pneumovax 23. If the individual has already received a dose of Prevnar 13, another dose is not required. Risk conditions for pneumococcal disease, or people with risk conditions for pneumococcal disease, need a total of 2 lifetime doses of Pneumovax 23 in addition to the Prevnar. And just to note that the annual influenza vaccine is still recommended and funded for adults from 65 years of age. It'd also be important to note here as well that it's fine to administer the Prevnar 13 at the same time as the Zostavax recommended for 70-year-olds. And just to note as well that from the 1st of July, anyone who's older than 70 who hasn't previously received a Prevnar 13 would be eligible for that. So notes or considerations that are important for general practitioners and practice nurses in rolling out these changes. We would really urge you to actively identify and recall patients who meet criteria for these additionally funded vaccines. So have a look at your patients and identify those that are Aboriginal and Torres Strait Islander, children and adults, anyone with the specified medical conditions for either meningococcal disease, pneumococcal disease, or Hib, and older Australians, older adults who are 70 years of age and above. And before vaccination, look on the schedule, which we hope will be coming out obviously very soon. It's just being finalised, so look on the Queensland Immunisation schedule and check for the right vaccine, the right age, and the consideration of their Indigenous status, their medical risks and their age check their Australian Immunisation Register history for their immunisation history, and also make sure you take a detailed history from them, because there is sometimes or often a backlog or a delay in things getting onto air. So people may have, for example, got a Pneumococcal on the school immunisation program. They may have got some vaccines at a different practice a week ago. So just make sure we're relying on their verbal history as well as the immunisation history. And also refer to the handbook, the Australian Immunisation Handbook online, or the app for further advice about the recommendations and funding. And if there's any doubt or confusion, please don't hesitate to call the Sunshine Coast Public Health Unit for any of those day-to-day questions or catch-up concerns that you have. Now, also just to note, the National Catch-Up Calculator will be replacing the South Australia Health Catch-Up Calculator, and this will be available from July, and it can be accessed from the Handbook website. So it will be applicable for children under the age of 10, and you'll be able to insert their immunisation history using antigen or vaccine name. It does require inserting their Indigenous status, the state where the child lives, and their past vaccination history. So this will be a great aid in working out catch-ups as well. And just moving on to the next slide there. So just to go over the key resources that will be able to assist you, obviously the handbook and the online and the app, which I've mentioned. The National Catch-Up Calculator that will be accessible from the handbook. The National Immunisation Program have a suite of fact sheets provided for each of these vaccine changes. And from the Australian Department of Health website, you can click on resources and then do a search for ATAGI, and then the whole suite of ATAGI clinical advice statements will come up, and they're to be read in conjunction with the chapters in the handbook, and they give a really clear statements about the clinical evidence involved in each of the vaccine changes and practical advice for clinicians in implementing the changes. The Queensland Immunisation Program, of course, will provide the new schedule soon, and it's, from what we have seen of it, will be use obviously a lot of colours like the current one does, but also shape coding to try and make it as user-friendly as possible, and trying to visualise the vaccines due at each age and for the different groups. We've also got the National Centre for Immunisation Research and Surveillance that also have a range of fact sheets for the different vaccines, and they also have a webinar currently available on their site with some of the experts down there explaining the evidence behind these changes. And of course, it's our public health unit as well. The contact number's there for you. So please, as I said, don't hesitate to call us if you have any questions. Thank you very much, everyone. And if there's any questions, I'm happy to answer them.
Thanks, Victoria. I've got a few questions here. Jacqueline Antworth has asked, the product information and handbook state not to give Bexsero prior to 2 months of age. Is it okay to give it at 6 weeks?
It is funded from 2 months of age. So there's no recommendation at this stage to give it prior, but I might have to come back to that, because I'll just have to look into it, whether they have said that it's okay. So if we can go on to the next question, and I'll just see if I can confirm that in the meantime.
Sure. I've got another question, this time from Violet. She said, can you please replay the pneumococcal slide for 70 years and just go back through that again?
Oh, yeah. Yeah, so all non-Indigenous adults are now recommended to receive the Prevnar 13 at 70 years of age. So if they have previously received a Prevnar, they don't require another one. This is replacing the recommendation to have a Pneumovax 23 at 65 years of age. Basically, all adults at 70 years of age who don't have specific risk conditions for pneumococcal disease are funded to receive a single Prevnar 13. In the case of Aboriginal and Torres Strait Islander people aged 50 years and older, they're now recommended to receive the Prevnar 13 at age 50 instead of the Pneumovax 23. And they are now funded to receive two doses of Pneumovax 23. The first one should be given 2 to 12 months after the Prevnar 13, and the second one should be given 5 to 10 years after, preferably 5 years after the previous Pneumovax 23. So there's a total of 2 lifetime doses of Pneumovax 23. And just note that the interval, if somebody has previously received a Pneumovax 23, it's important that there is a minimum interval of at least 12 months between a Pneumovax 23 and a Prevnar 13. But if the Prevnar 13 is being given first, then the minimum interval is 2 to 12 months.
Okay, thank you.
Yeah.
Can I move on to the next question, Victoria?
Yep.
I think you might have answered this already, but will we be receiving posters with the new schedule?
Yes, you will be.
Yep. And will there be any advertising to the general public about the new schedule?
Well, that's one. I don't fully know the communications plans to the general public, so I will have to follow up on that one as well.
Okay. Got another one here. Is it correct that all over 70-year-olds can receive a Prevnar 13 independent of previous vaccination?
Could you repeat that, please?
Is it correct that all over 70-year-olds can receive a Prevnar 13 independent of previous vaccination?
If they've received a previous Prevnar 13, there's no need for them. Yeah, they shouldn't be receiving another one. There's only recommendation to receive the one Prevnar 13. So as of 1st of July, anyone turning 70 should receive the Prevnar 13 if they haven't already had one. And anyone over that age who hasn't already received one would be eligible for one.
Okay. I'm not sure if you've just answered this next question, but if a person over 70 has received 2 Pneumo 23 already, do they still need a Prev 13?
Yes, they should, even if they've received the 2 Pneumovax 23. Just make sure that the Prevnar 13 is given at least 12 months after the last dose of Pneumovax 23.
Okay. I'm just reading these questions. Thanks everyone for sending them in. We've got one from Carmel. From what I've read on the NCIRS website and Ataji is that, I guess it was Bexsero can be given at 6 weeks. So that refers to that previous question.
I'll get back to people on that one. I'll take that and get back to people if that's all right.
Yeah. Okay. Another question has come in. Also, the NCIRS webinar advised different injection sites. They've recommended 2 in each leg, Prevnar and Bexsero not together. Handbook states the ventrogluteal site should only be used from 12 months. Can you comment on that one?
Yeah, there wasn't as much emphasis in the NCS webinar about using a different limb. However, that is the advice that's come out to us from Queensland Health. The handbook states that for under 12 months, the anterior lateral thigh or the ventrogluteal is ideal because obviously there's not enough muscle mass on the deltoid muscles. But there's obviously the risk if the ventrogluteal site isn't identified correctly and you injecting into the dorsogluteal that the it's obviously not going to have adequate immune effects. So that's why we would be hesitant to recommend that. So obviously there needs to be some clinical judgment there. But I had a discussion with Gail from Wide Bay, and her thoughts were that she would prefer people to separate them by 3 days unless there was that concern that they wouldn't represent, in which case the ventrogluteal site was an option for a fourth injection site.
Okay, thank you, Victoria. Jody is asking, are we able to get a copy of these slides, please? And the answer is yes. A copy of the slides will come out with your certificate of statement of attendance. And there will also be a recording of this webinar. So if you have any colleagues that might have missed the webinar, we'll be sending out a recording as well. I've got another question from Diana. This one is, Pneumavax 23 is in short supply. Is this going to improve soon?
That's probably out of the scope of this webinar, unfortunately. I wouldn't be able to confirm that, I'm sorry.
That's okay. And okay, this one is, what is the likelihood of non-Indigenous getting Bexsero as is currently in South Australia in the future?
Once again, that's not for me to predict. I'm sorry, I wouldn't be able to make that prediction.
That's fine. Can I just put a call out to all the attendees if there's any other questions? And if not, we'll finish up. I've got another one.
One more thing I didn't point out is just that there's some really helpful infographics in the handbook as well, in the resource section of the handbook. So if you go to the resources, you can go to the infographics, and it goes through each of the different the groups. So vaccination for healthy aging, vaccination for people who are immunocompromised, for people with specific medical conditions, and for Aboriginal and Torres Strait Islander children. So amongst other things. So if you haven't already seen them, make sure you just go and have a look at them, because they're very, very helpful and very visual as well.
Thanks, Victoria. I've got another question. For Prevnar 13 for not at-risk people, aren't children getting them at 2, 4 and 12 months, hence 3 total doses, which is different to the adult suggestion that they should have 1 recommended dose? Are the total doses different for adults and children?
Yes, they are. So for children, for healthy children, the primary schedule is the 2+1. So they're getting it at the 2-month, 4-month, and 12-month mark. For adults, people over 5, obviously through to adulthood, the recommendation, well, not for over 5, but basically once you're over 5, the lifetime number of doses that you would need at any one time would be the 1 dose. And obviously for people under 70, you would only be getting recommended that if you have specific medical risk conditions.
Okay, thank you. I've got another. Yep.
Though the recommendation is to make sure you're referring to the catch-up table in the handbook, because it will depend on the age you present and the number of doses you've previously received as to how many doses you need to receive.
Okay. I've got another question for you from Robin. Looking at the table 1 for funded pneumococcal vaccines, it seems that people with chronic liver disease are recommended but not funded for additional pneumococcal vaccinations, so they would have to pay for these privately. Is that correct?
Looking at which table, sorry?
So looking at table 1 for funded pneumococcal vaccines, it seems people with chronic liver disease are recommended but not funded for additional pneumococcal vaccinations.
Are they looking directly in the handbook possibly, or?
I'm not sure. Robin, can you send us another question to clarify that?
Yeah, just because the table I have included here is a summary of those that are funded. So
okay.
Let me know if
we might clarify that at the end of the webinar, or with a frequently asked questions out to all attendees.
But the hematological malignancies, if that was what she said, that is funded.
Okay, thank you. I've got another question this time from Nikki. ATAGI advice regarding Bexsero appears to be from March 2014. Should practice nurses look at vaccinating at 2 months rather than 6 weeks since intro of Addisil in pregnancy?
Yeah, well, that's the thing. In the past, obviously, that recommendation about 6 weeks was because because people were encouraged to get those initial vaccines from 6 weeks, but now that's changed and the funding actually is from 2 months of age. So there wouldn't be any recommendation for people to be getting vaccinated at 6 weeks of age. So yeah, definitely the schedule is from 2 months now.
Okay. This one's from Emil. Would you give Prevnar 13 if a patient had a severe local reaction previously to Pneumovax 23?
Well, once again, it would depend on the specifics, but there isn't any direct contraindication to further vaccinations based on a local reaction. So you would obviously, I wouldn't be able to sort of comment directly on that without the full details of the situation. But certainly if somebody's had a previous injection site reaction to Pneumovax 23, that's not a contraindication to being vaccinated with Prevnar 13.
Okay. I think we're just about at the end of our questions from this end. Robin has just, she must be commenting on a previous question, saying that it's on a brochure called Clinical Decision Tree for the Vaccination Providers. I think it was referring to the previous question around funded pneumococcal vaccines, I think. Apologies if I've lost track of that.
Sorry, do you mind just repeating the question?
It's not really a question, it's a comment from someone that there's a brochure called Clinical Decision Tree for Vaccination Providers. Are you aware of that one, Victoria?
No, I'm not aware of that one.
All right, we might move on and we can address that after the webinar. I've got another question just come through. Are diabetics funded for Pneumovax under the new changes? Apologies if this was already covered.
I missed the first part of that question, sorry, what was?
Are diabetics funded for Pneumovax under the new changes?
I would have to look specifically at the table, but I have a feeling that's one of the ones that is now recommended but not funded, and I think that was actually in, yeah, so it is in one of my slides I just mentioned. So just note that some previously considered eligible for funded vaccine are no longer on the list, and diabetes is one of these. Smoking is another one. So they both used to attract funding, but now they are in the list as recommended to receive additional doses of pneumovaccine, but they're not funded for them.
Okay. I think we've, oh, here we go. There's always another question. From the 5th of the 4th, 2014, 4CMEMB was registered for use in persons 2 months and older. Not sure if that's a question or a statement.
Yeah, I'm not too sure about what the question is there, sorry.
That's okay.
Maybe
we might leave it and address it afterwards. For those of you who are sending in questions, thank you very much. It's very hard to answer everything on the hop at times, but we'll certainly address each of these and send out information to all of you. I think that is pretty much all the questions that have come through. So thank you very much, Victoria. We might wrap up the webinar there. Thank you everyone for logging in tonight and giving up your time to learn about the new National Immunisation Program changes. You will receive an evaluation in the next 24 hours that we'd really appreciate you to fill out. You'll also get links to the recording of the webinar and a certificate of attainment or attendance for coming along. So if you have any other questions, you can still submit them, and we'll certainly send some answers through to all of you. Is there anything else that you'd like to end off on, Victoria, before we go?
No, I just want to thank everyone for coming along tonight, and yeah, obviously in the coming week we'll the new schedule will be released, so we'll have further communications around that, and just the questions that I wasn't able to answer tonight, I'll work with Jodie and the team to get some answers to you about those ones in the coming days.
Okay, thank you very much, and good night, everyone.
Thank you, Jodie.